Vitamins, particularly vitamin A, is the topic of discussion between hosts Dr. Shambhu Banik and Dr. Lalita Kaul. Dr. Kaul is an author of several books and papers, and she's also a well-known teaching professor at Howard University College of Medicine. Back to the topic for today in health and nutrition.
Good morning. Welcome to Global Television Network's Health and Nutrition program. This morning, we are very delighted to have one of the outstanding authorities in the field of nutrition, Professor Dr. Lalita Kaul. She is here by popular demand. Dr. Kaul, welcome to Global Television Network's Health and Nutrition program.
It's a pleasure to be here.
This morning, we are going to talk about vitamins. Varieties of vitamins we have got, and it's a $1 billion business. So my first question to you, what is a vitamin?
Vitamins were discovered in 1912 by a Polish scientist, and as we know, many of the medicines, vitamins have been, due to there were some chronic illnesses, and he discovered that this was a magic thing. It helped the skin, helped the eyes. So he started calling it vitamin. There was E. Vitamins means important and amine means life. But as the time went by, E was dropped, and then vitamin was at that time like a magical pill. Anybody sick with any symptoms, especially eyes, skin, throat, well, give vitamin. That's how the word vitamin came about.
So you mean human body needs vitamins vitamins, whatever you call?
There are some vitamins we need from food, and there are some which are made in the intestines by the bacteria. And that's what I'm going to talk to you about today and next several segments. There are two types of vitamins. You might have heard it. There is fat soluble and there are water soluble. Fat solubles are vitamins A, D, E, and K. And by saying fat soluble, it means that they dissolve in the fat. So they are transported in the body attached to a fat molecule. See, fat is important in your body. You don't have, if you have a diet devoid of fat, you're going to be deficient in fat soluble vitamins, especially A and D. So we do need some fat. So you can call it like a bus, a transport system. As you take the vitamin A in the body, it gets on the bus and goes all around and this. Now the water soluble vitamins they're soluble in water. So if you take excess water soluble vitamins like B complex, vitamin C, we're going to talk about those also. And anything excess will be excreted in the urine. If some people say, well, I take massive doses, we have limited storage in the body, in the liver, in the kidney. The rest is excreted. So if you see your urine yellow, that means you're taking too much B complex. So that's the difference between fat soluble and water soluble.
Between these two, water soluble and fat soluble, which is the most important for human?
Oh, both are. There's so many. So what I'm going to do is talk about one at a time, and even that I have super summarized it. There's a course by itself on vitamins, but how much research has gone into it and where we are. And I want to bring you up to date. What is the current information? Today I want to talk to you about vitamin A. Many of you have heard it, and vitamin A, you need it from the food, you need it from diet. We cannot synthesize in the body. And vitamin A, is in a pure crystalline form. I don't want to go too much into the chemistry, biochemistry. I want to keep it very simple so that everyday life we do. That's what doctors have to finally translate into a day-to-day. So, in a pure you can get as a powder, just to show you, and it is soluble in fat. If you have problem with fat absorption in some diseases, you can't absorb the fat, they are going to be deficient in vitamin A. It also is found as a carotene, that is green leafy yellow vegetables. So, because the color is masked in the yellow vegetables, green vegetables by chlorophyll, but it is called pre-vitamin A because in the body it has to be converted to active form of vitamin A, and most of the vitamin A now it is absorbed with the fat and the bile, which is secreted by the bile duct. So, you have bile and fat, and once it is goes in the body, it gets hooked to the fat and it's taken to different organs, and most of it is in the liver, and it's about 90% is in the liver, and the rest is in the lung, adrenal glands, kidney. And so, if you take excess fat soluble vitamin, what can happen is you can get hypervitaminosis. Hypervitaminosis is toxic, and if you think I will take lot of vitamin A, I will see better. No, it will cause toxicity in the body, and the symptoms are worse than the deficiency. And it stays in the liver. As you get deficient, the liver sends to the body, it gets signals. Now, if your physician finds you have symptoms of vitamin A deficiency, and of course, he or she has to back it up by doing the blood test, and that means if you are deficient in vitamin A, that means for a long time you are not taking vitamin A, because in the liver you have at least 6 months supply, that means more than 6 months. Of course, the physician will find out whether the primary reason is there is malabsorption of fat, you have some disease you down, or you just simply are not eating, and at that time he or she should tell you. What are the deficiencies of vitamin A? Is very much with the eye disease, and
eye disease?
Yes, you can get night blindness, when suddenly the light falls on the eyes, you can't adjust it. So, night driving is difficult. Vitamin A deficiency is very frequent in India, and you have blindness and there is vitamin A deficiency. And you can get bite spots in the eyes, and night blindness. Other thing, vitamin A is important in epithelial tissues. I mean, all the lining inside our body is smooth and all. So, if you are vitamin A deficient, the lining gets the integrity of lining, everything in the lungs, heart. So, it is very important to maintain the integrity of epithelial tissues. Also, it is also important in the skin, and there is a condition called keratinization. And keratinization is if you have very rough skin and the hair stands up, follicular these things. Of course, if your physician finds you have all the symptoms, will definitely do the blood test to do it. It is also important, vitamin A, for growth, for normal tooth development, growth, and the amount we need is we call it 5,000 international units. But please do not take excess vitamin A, because we have had cases where we have mothers giving excess doses, and that is a problem too. So, best is to get from the sources. So, what are the sources of vitamin A? Fish liver.
Before you go there, let me ask you one question.
Yes, sure.
You mentioned about vitamin deficiency blindness in India, and you mentioned that most of the vitamin A come from vegetables, greens. India is well known for all kinds of vegetables. So, why so much blindness?
I tell you, green vegetables and fruits have pre-vitamin A. That means it is not ready made. The best sources are the animal sources. Fish is the best source. I don't remember if in your childhood, depending if you are my generation, they used to give you so much cod liver oil. Every time I looked pale, my parents will send me to my doctor uncle, and I was getting 2 tablespoons of cod liver oil. Of course, the best is fish and whole milk and nowadays you want to watch for the fat. So, they have also milk which has been irradiated with vitamin A, and all liver, people may not like it or they have to watch their cholesterol. So, fish, milk, cheese, dairy products are the best. The second best is if you are vegetarian, then to get it as much for fruits and vegetables. Good question is, yes, why don't we get in India, they eat. But you know, if you look at in the lower income area, there is a lot of vitamin A deficiency. They don't get fresh vegetables and fruits. Even in India, if you are living on an Indian income, you cannot afford. I could see that nobody can afford, middle class family cannot afford juice or to buy this thing. So, what do they end? Dal, which is very good source of protein, dal chawal, which is a thing. And they have opened free eye clinics where not only deficient of the cataract surgery, but just most of the conditions in developing countries, about 80% can be cured by giving vitamins and protein, and rest are this thing. And also, now that we are talking about that, they are mixed with some other things.
Okay.
So, yes, go ahead.
Now, you talked about the fat soluble. Now, give me some example of the water soluble vitamin A.
Oh, there is no vitamin A is fat soluble. Now, the water soluble, when we start talking, is your the most important one are B complex, thiamine, riboflavin, niacin, folic acid. These are only some of them. Like thiamine is called antineuritic vitamins. If you have pain in the legs, of course, the physician, he or she will find out, is there a reason? Or I am definitely having a 2-3 segments on water soluble. Vitamin C is a water soluble. So, if your gums are not working properly or you get red blotches on your hands, that means there is not vitamin C to convert one amino acid to another. I mean, there are chapters and chapters, there are a lot of. So, my plan is in next few segments to talk about fat soluble, then move on to water soluble, and then to minerals, so that when you see on the bottles written, you understand what it is. So, if you are a fish lover, great, it has omega, it has your vitamin A. And if you are not a fish lover, if you can take milk, yogurt, cheese, low fat, we want to cut the fat. But if you don't like it, lot of vegetables and fruits. And to keep your, I tell, when my daughter was young, I said, you want nice and smooth skin? She says, Mommy, I want skin like you. I said, oh, you got to get this fruits and vegetables. So, at each level you have to. But vitamin A deficiency can really carry havoc in the body, in the skin, in the eyes, in the epithelial tissues. It is very, very important.
What is hypervitaminosis?
Hypervitaminosis is like if you take more than 50,000 international units. Now, remember, 5,000 is recommended. So, what happens is there had been a case where this mother was feeding excess and the child was restless, getting bloated, not able to sleep. So, anorexia, not being hungry, losing weight, hyperventilation. And it is very difficult to find out unless these days we have put in the medical curriculum nutrition. 15 years ago it was not. So, when I came on the scene, not me alone, there are hundreds and thousands, was nationally it was recognized that nutrition education is very, very important in the curriculum. So, a patient, physician who is well versed will see something is wrong. Usually you come with a chief complaint and then the physician acts as a detective to find out what is going on.
Thank you. Now, we have got 45 seconds. So, I would like you to summarize in 40 seconds about the first presentation on vitamins.
Oh, vitamin A in general, it is important. You should get it from the diet. The deficiency can affect the eyes, the skin, inside tissues, breathing. Do not take excess vitamin A. It can cause worse symptoms. The sources are fish, dairy products. If you don't like these things, get lots of fruits and vegetables in your diet to be healthy. Have good teeth, good skin, and good see well.
Well, thank you, Professor Kaul, for enlightening us with the importance of vitamins this morning.
Thank you. It has been a pleasure to be here.